slide. All right, we'll start with what most of us have currently is an upper respiratory infection. Me, I'm a little nasally drip, all that stuff today. This is, generally called the common cold. Usually it's caused by a virus, so there's not much you can do as far as treatment, like an antibiotic won't help. There's over 200 different viruses that can possibly cause a URI, so they constantly are changing. So like one person, that's why they're so contagious, right? Because if you get one strand, usually you become immune to it again, but since there's so many different viruses, the likelihood of the person next to you having the exact same virus is very slim. So people just keep getting colds over and over again because they keep getting exposed to a different one. Does that make sense? That's why they're so, contagious. You can get them over and over. Basically what's happening is the mucous membranes are getting inflamed from the immune response. So you have like the typical nasal congestion, discharge, sneezing, watery eyes, sore throat, all that kind of normal sick stuff. Diagnostic-wise is generally just you can tell if someone has a cold based on their symptoms, right? You can do like a nasal, do a culture of the sputum, but that really only helps if it's caused by a bacteria, because then you can put them on an antibiotic, but generally it's a virus and there's not much you can do except for treat the symptoms, with NyQuil, Dayquil, and just kind of wait for it to run its course. There's no cure because, again, we don't have any cures for viruses, right? We just have to hope and pray. Rest, increasing fluids. There are, common over-the-counter, that's OTC, over-the-counter drugs that most of us know about. We'll talk about more of these at the end. Antihistamines, these are the ones that address like the itchy, watery eyes, like Benadryl, that's a common antihistamine. Decongestants, it gets rid of the swelling that's like blocks up your nose, you can't breathe. Expectorants, these are ones that help you cough up the mucus so it doesn't stay in your lungs. And cough suppressants, this is to keep you from coughing so much so you can sleep, And then prognosis, this is an acute illness. It comes and goes. It's very contagious. Any questions over colds? Okay. All right, another common one, sinusitis. This is where the membranes of the sinuses become inflamed. It can be fungal, bacterial, or viral, so lots of different options. Symptoms of this, you have pain and tenderness, especially right by your nose, right here on the side of your nose, or sometimes right above your eyebrows is pretty tender. That's where the sinuses are. I once had such bad sinus pain that I thought I had a infected tooth, just because the inflammation spread down into my tooth and it hurt so bad. I went to the dentist and they're like, "There's nothing wrong with your tooth. You just have really bad sinuses." I don't know if anybody else has ever experienced that, really bad sinuses or not. If it's bacterial, usually you'll have a lot of greenish yellow mucus. If it's viral, usually be more clear, clear drainage. You can use a culture to identify the bacteria if it's really bad. Generally they don't do this. It's not a standard thing they do. They don't just swab everything to treat it, because usually it's not that severe. Usually you just treat the symptoms and it goes away. But if someone has a really bad case and it's just not going away, they might do that to know what exactly
that doesn't even probably cure it, right? Or does it?
Huh?
Does that even cure it? Is it just...
It helps the healing process, right? Because it gets all of the gunk out of there, drains it.
Especially if you have chronic sinusitis and the doctors just continue to give you antibiotics.
Yeah, some people have really bad cases, or they just have chronic issues.
I had what they call the fungal ball.
Yeah.
I can't be around those people. I can't listen to that all day.
Yeah, most people don't have that much of issues with it. You get it and it resolves itself. So usually it's acute. Some people have really bad, chronic issues with it. So
I already have sinus issues, so when I get this.
This is what the sinuses look like if you were to look through the skin. So a lot of the sinuses are up here. So that's where you get a lot of pain, kind of right in your right here. And you notice that there's some right here as well. This is the one I had really bad, right in this area, and it was making this tooth hurt so bad because of the pressure. So I thought that I was oh my gosh, my tooth is rotting. But no, it was just sinusitis. All right. Now, pharyngitis. Pharyngitis is just the medical term for saying inflammation of the pharynx. The pharynx is the throat. So this is a sore throat. Okay, people think of like strep throat is the most common. Strep throat is specifically a sore throat or inflammation of the throat caused by streptococcus bacteria. Okay, so not all sore throats are strep throat. Right, a sore throat can be caused by a virus. It can be caused by a different bacteria. Strep throat is just like the common, like layman's terms. People say that just to mean that they have a sore throat, but that's not necessarily technically correct. Just because you have a sore throat doesn't mean it's strep. So what else? Pretty common symptoms. People usually get a slight fever with strep throat. Dysphagia. Who knows what dysphagia is? What's that mean?
Hard to swallow?
Yep, difficulty swallowing. Because like your throat can be sore and kind of swollen, right? Lymphadenopathy. What about that one? The lymph nodes are swollen, so you can often feel like right here, like those little round little bumps that get swollen in your neck. That's the swollen lymph nodes. You can see, like if you look at someone's throat, they say, ah. This is what you might see in the back. They call those tonsil stones, or the medical terminology is tonsillar exudate, right? It's oozing that pus. Tonsillar exudate is those tonsil stones. Diagnosis, really just look at signs and symptoms. You can do a strep test, they do swab and see if it's caused by strep. If it is caused by strep, they'll give you antibiotics. If it's something viral, then they won't, because an antibiotic won't help. Again, prognosis, generally this is an acute problem. It's contagious, and it usually resolves itself quickly. All right, laryngeal cancer. So this is cancer of the vocal cords. So the pharynx is like the throat, the larynx is where the vocal cords are. Okay, so just some review of anatomy. This is what the larynx looks like. These are the vocal cords here, and so a tumor on them looks like something like this, right? So that's a laryngeal cancer tumor growing on the vocal cords. So you can imagine that if there's a growth on the vocal cords, what might be some signs and symptoms that you would expect?
They can't talk.
The voice is going to sound weird, right? So hoarseness and raspiness, like, it sounds like you've been like, when you yell and you lose your voice, it like you have that, but like for no reason. Like you might think, oh, well, I may be sick, but it doesn't go away. So it's hoarseness that gets worse, right? Because the tumor is like growing. Again, dysphagia, difficulty swallowing because there's literally a tumor blocking your airway, right? What's hemoptysis? Right, so it has to do with blood, heme, right? And it has to do with the cough. So this is bloody cough, so like coughing up blood. That's because the skin is going to be more irritated with the cancer there. Cough, pain in the ear, stridor. Stridor is a specific kind of lung sound. So like if a doctor's like listening to your lung sounds breathing in and out, stridor is just going to be an abnormal lung sound that they hear due to the turbulence of the air from that laryngeal cancer there. So diagnosis, they're going to do a biopsy, obviously, to figure out if it's benign or if it's malignant. And then, how they always say, like, stages, like, stage 1, 2, 3, whatever. They do that based on the TNM system, which stands for tumor, node, and metastasis. So they look at the size of the tumor, right, if it's small or if it's really big. Nodes, this is talking about the lymph nodes. So if the cancer has spread to nearby lymph nodes, that's going to be worse than if it hasn't, obviously. And then metastasis is if it has gone to other places in the body. So based on how bad all of those things are is how you get your staging. Like if it's, you have stage 1 laryngeal cancer or you have stage 4, you know what I mean? So they have staging for all types of cancers. And then they can also do CT or MRI of the body, and that's how they look for metastases, to see if there's cancers showing up anywhere else in the body. Does that make sense? Treatment-wise, you can do, chemoradiation, the normal cancer stuff. So a laryngectomy is also an option. What does this word mean? What's ectomy?
Ectomy when they remove.
Right. So a laryngectomy would be a removal of the vocal cords to get rid of that, to cut out the tumor. Obviously, the downside to this is that you will lose the ability to speak, right? Because your vocal cords are not there anymore, right? So obviously that's not everyone's first choice. They probably opt for chemoradiation first to see if that, works. But I guess some people might be more willing to treat it aggressively by cutting it out. So that's, you know.
But when you lose your vocal cords, that you can still like.
I mean, you can breathe and kind of, but it's not the same. Like you wouldn't be able to talk normal. You know, depending on how much they had to remove. You know, they might not have to remove all of it.
So noise, like a sound.
Yeah, it's just the voice is just gonna be altered.
Them people have that vibrating thing?
Some people.
Yeah, is that on the
Yes, they do have some ways to be able to communicate a little bit, but it's just not.
Not the same?
It's not the same.
Okay.
And depending on how much cancer there is, they might only have to remove a small part, or they might have to remove a lot. You know, so it kind of depends on how bad it is, how much you'll be able to speak. And then obviously prognosis is just dependent upon how bad it is when they find it. You know, stage 1 is obviously easier to treat than stage 4. And again, that's what that looks like. All right, pulmonary embolism. This is a blood clot going to the lungs. This is a life-threatening situation. Okay. So you guys know what a heart attack is, you guys know what a stroke is, pulmonary. So basically what's happening is a clot is going to either the lungs, which is a pulmonary embolism, going to the brain, which is a stroke, or going within the heart itself, which is a heart attack, right? And the reason why this is a problem is the clot is blocking blood flow from getting to that organ, right? So if blood can't get to an organ, eventually it dies, right? So that's bad. So if a clot gets to your lungs, your lungs become unable to work, and obviously you need your lungs to live, so that's why this is potentially fatal, right? So most often it's a clot, which is of blood, but it can also be from other things. So an emboli just means a moving object that's blocking the artery. So it can be a thrombi. A thrombi comes from the word thrombocyte. Remember we talked about thrombocytes in immune, that was platelets, that's the medical term for platelets. So it can just be a clot, which is the thrombi. It can be an air bolus. I don't know if you ever heard about, you know, if someone injects too much air into your veins, or if you ever, like, you know, heard about, like, in nursing, they have to make sure that there's no air in, like, the IV, because the air can actually block off. You shouldn't have air in your arteries. Sometimes fat can break off if someone has, like, a lot of, like, clogged arteries with, like, cholesterol and stuff. Sometimes some of that can break off and start traveling through the bloodstream and cause an obstruction and blocking the blood. So lots of different things can cause a blockage, if that makes sense. The most common is a blood clot. What makes you more likely to have a pulmonary embolism, some risk factors, is immobility. So people that are sitting around laying in bed all day, especially like in the hospital, people that are like on bed rest or ICU, your blood isn't moving that much. You know how like if you've ever seen like a fast flowing river, the water is like quickly moving, but in like really slow like ponds, you get like a weird nasty film on the top of the water because it's not moving, right? So same thing with your bloodstream. If your blood is just kind of like sitting still and you're not like exercising, your heart rate isn't up, you're not moving around, your blood can start to congeal and like get thick, kind of like a nasty pond scum. Does that make sense? So that can, and then it can eventually cause blockages. So immobility is a big one. Anybody here ever, if you take birth control, one of the biggest side effects of birth control is clotting. So oral contraceptives. That's why they don't give birth control pills to people that smoke, because people that smoke are also at higher risk for clots. So those two combined make it just too much of a risk for you to develop some kind of clotting issue. DM is diabetes. I mentioned smoking, and MI is a previous heart attack. So if you've had a heart attack in the past, myocardial infarction is a risk factor as well. So symptoms of this is that sudden onset of dyspnea. Dyspnea is difficulty breathing. So all of a sudden you feel like I can't breathe right, obviously because there's a blockage to your lungs. A lot of people report this feeling of like apprehension, like they start feeling really anxious. Some people say it feels like a sense of impending doom. They just feel like panicky, like something is like wrong, right? Because your body just can sense that there's something wrong. Trying to cough, trying to like feel like you need to like clear something, chest pain. And what's tachypnea? What does tachy mean?
Fast.
Huh?
Fast. Lungs.
Yep, and so you're breathing quickly, right? So your respiratory rate will be higher because you're trying to like get more air. Normal respiratory rate is like 12 to 20, so people with tachypnea would be like over 20 breaths per minute, so like 30 breaths per minute, trying to like hyperventilate kind of thing.
How do you pronounce it?
Tachypnea. Tachypnea. Yeah, it's kind of a weird, yeah. Diagnosis, they're obviously gonna do like scans, like a CT. We'll see the clot, just to kind of visualize what's going on. They can see where it is. Treatment-wise, they'll put you on oxygen. An anticoagulant is a kind of medication that is a preventative, but if you actively have a clot already, a preventative isn't going to really help you, so they'll give you a thrombolytic. Thrombo, again, is from the word thrombocyte, which is platelet, right? And then lytic means to break down, so it's literally to break down a clot, right? So if they see that you have a current clot, they'll give you a thrombolytic. And then again, prognosis, it depends, like if they catch it early and they're able to remove the clot, or if they can't, then it can be fatal. And this is kind of just a visualize like what that might look like, something blocking the arteries so the air can't and the blood can't get through. All right, pneumonia, another common one most people have already heard of. So pneumonia can be caused, again, either by bacteria or virus. HAI stands for hospital-associated infection. So a lot of the times, because you're surrounded by sick people in the hospital, you're more likely to pick up something in a hospital than you would be at home, right? So hospital-associated infections means like you caught it because you were in the hospital. A lot of times people get it from being on a ventilator, because a ventilator is like literally pushing oxygen and stuff into your lungs. So if they're contaminated anyway, they're like literally pushing like toxins or bacteria or whatever viruses into your lungs. So that's why it's like being sterile and clean in the hospital is really important, so people don't get sicker from being in the hospital. But that's a really common way people get this. An exacerbation of a URI, so that just means that your cold got really bad and the mucus like settled into your lungs and you weren't able to like cough it out and keep your secretions clear. Right? So most people are able to like have a cold and it's be fine. A lot of older people, they get sick and then they kind of get worse, just because their immune systems aren't as good as they were. So they could have gotten the common cold and then their immune system were just kind of overwhelmed, or they weren't able to get better, and then it kind of progressed into pneumonia. Pneumonia, it's considered pneumonia once that is like into the lungs, right? But with a common cold, it's an upper respiratory infection, meaning it's like up here. It's like in the nose, in the throat, but then pneumonia is like settled lower, like into your actual lungs itself. Does that make sense? Aspiration is another one. Aspiration just means accidentally, like, have you ever had something go down the wrong pipe, like you're eating soup or something and you accidentally like inhale it versus it going into your stomach? So if you accidentally like aspirate, that's what they call like sucking water or soup or something down into your lungs, that stuff can like get gunky in there and start getting like an infection if they don't get it out, and it can cause pneumonia. And again, this is more common again with the elderly or people that have difficulty swallowing, because like people with laryngeal cancer, for example, if they're not able to swallow correctly, it could go down the wrong pipe. So you guys know the symptoms of pneumonia. People cough a lot, they might have a fever, shortness of breath, chills associated with the fever. Who knows what diaphoresis is? Sweating, yeah. So just like you're just sweating usually from like being feverish. Maybe some chest pain, and when they say chest pain, they don't mean like the heart, but like the lungs are like they just ache because they're inflamed. Cyanosis is what happens when you have not enough oxygen, so you can kind of start turning blue. It can also happen when you're cold too. Like you've ever seen like your lips turn blue when you're out in the cold for too long? That's cyanosis, is like turning blue from lack of oxygen. And then again, hemoptysis is that bloody cough, bloody sputum. They diagnose pneumonia with chest X-ray. They can see the fluid in the lungs. They can also do a sputum culture, so they swab and see what bacteria it is. Give antibiotics, and usually it's acute. You can resolve from this. Other times, especially people that are old, the elderly are more susceptible to for fatalities related to this. Younger people typically don't have too many complications from pneumonia unless they have like really bad immune systems, And here is a picture of what like is actually happening in the lungs. So at the very end of this is your bronchi, right? And then at the very end of the bronchi, you have these little sacs, which is where the oxygen is actually exchanged in your body. These are called the alveoli, and you can see how they're just kind of filling up with mucus and fluid. So that makes it difficult, obviously, for oxygen to get through. So this is what's happening in pneumonia. Okay. All right, who's heard of RSV?
Yes.
This is most common in who?
Kids.
Kids, right? You don't really hear a ton of adults getting RSV. I mean, it's possible, it's just not as common. Elderly also are more susceptible. So this is just a lung infection in children, very contagious. It's gonna be cold-like symptoms as well. Otitis media, this is just an ear infection. Yeah, so they can often get ear infections along with RSV. A lot of coughing. They usually have high fevers. Malaise, that's just the general feeling of bleh, kind of like that sick, I don't feel like doing anything feeling. Lethargies, tiredness, dyspnea, difficulty breathing. And again, diagnosis, they can just do, examining the nasal secretions. It's a virus again, so there's not really much you can do as far as cure, except for just wait it out and treat the symptoms. The biggest thing is just treating the fever. You don't want to get the fever to get too high, so antipyretics. Anti means obviously to prevent or like against, and then pyre. Anybody heard of like a funeral pyre? It's like a fire, right? So pyre means it's talking about fire. So antipyretics just mean like reducing the heat. So like fever. Antipyretics are reducing for fever. You can also give a nebulizer. That's what this thing is. It kind of like you breathe in the medication. It goes into your lungs to help you to open up your airways, make it easier to breathe. Sometimes like the inflammation can be so bad the airway can kind of close up. It's kind of like, it almost gives you like an asthma like feeling where your lungs kind of are hard to breathe. And again, usually this is acute, people get over it. It's just kind of managing symptoms while you wait for your immune system to tackle it. So not much really you can do other than symptom management with viruses. Influenza, another virus. This is, the flu. Again, viral. It's spread by people coughing. The droplets get in the air. There's the digestive kind of flu, with the diarrhea, and then there's also like a respiratory flu. So we're gonna be obviously talking about respiratory flu since we're in the respiratory chapter. So coughing, fever, headache, sore throat, all that normal stuff. It can be hard to differentiate sometimes between flu and a cold, and ultimately it doesn't really matter because they're both likely viral. So there's the symptom management with the treatment is going to be the same. Just treating the symptoms, rest, fluids, keeping your fever down, things like that. Bed rest. There is one specific antiviral, oseltamivir. We know it's an antiviral because it ends in what? Vir, right? So virus. This one's specifically for the flu. If you give it within the first day or two of the onset of your flu symptoms, it can help the course of the illness, make it shorter. Sometimes people have the flu for a week. It might help you reduce the length of the flu or the intensity of the symptoms. Some people say it doesn't really do too much. Other people say it does. So it just kind of depends on the person. But that one's something you can give. All right, now we're going to talk about COPD. COPD is an umbrella term. Okay, so there's several different types of diseases that fall under COPD. So the ones we'll be talking about is chronic bronchitis and emphysema. Also, asthma is considered a COPD, but this one for some reason isn't in the book, which is baffling to me. This is a very common and important respiratory disease. That's why I made it as part of your homework to talk about asthma, just because I feel like that's a really important one to know. So it won't be in the PowerPoint because it's not in the textbook. But COPD stands for chronic obstructive pulmonary disease. So basically all three of these are going to be chronic diseases. They're not acute. This isn't something you get over, right? You have these kind of forever. They're a chronic disease. And what's happening is that there's some kind of obstruction, which is preventing the airflow from happening normally. Okay, it's irreversible. This is something you just have for life. Sometimes you have triggers and it's worse than others, kind of like an autoimmune condition where sometimes you're fine, other times you have flare-ups. So the first one we'll talk about is chronic bronchitis. There is an acute version of bronchitis, but chronic bronchitis is the chronic one, obviously C for chronic. You can get an acute version of bronchitis and not have COPD, right? You have bronchitis and you get over it, but we're just going to talk about the chronic version. So typically people who get chronic bronchitis either are smokers or they have been exposed to lots of harmful chemicals like in their job, people that work in like factories, or people that, do a lot of paint, like the fumes, like spray paint or whatever, kind of get into their lungs and damage it. Or they just have recurrent infections chronically, like their immune system isn't great, and so it just causes kind of damage to their lungs. Even mold exposure can give people chronic bronchitis. So basically what's happening here is the bronchi, those airway tubes, are inflamed, right? Bronchitis. Itis means inflammation. So people with chronic bronchitis, they just kind of have this constant deep cough. And productive means that stuff is coming out. So a productive cough means that you're able to cough up mucus versus a dry cough or a non-productive cough just means that you cough and nothing comes out. Okay, so these people are constantly like coughing up mucus all the time. They're short of breath. They wheeze a lot just because those airways are constantly irritated. How we diagnose this is something called pulmonary function tests, or you might see PFTs. Another term for this is spirometry. I don't know if any of you have asthma. Yeah, where you have to blow into like a little tube and it measures your lung capacity and your airflow. They do this as a diagnostic for COPD, for asthma, to kind of measure where your lung function is at, okay? They can also do chest imaging just to see that those bronchi are inflamed. ABGs, I mean, you can do these. They're the blood gases where they take your blood samples and see how much oxygen and carbon dioxide is in your bloodstream. Generally, they don't do that a ton, but if necessary, if you're having like a bad episode, they can give you supplemental oxygen. People at home have oxygen tanks that they can use. Inhaled corticosteroids are going to be a big one. Just keeping that inflammation of the bronchi reduced, right? That way you can actually breathe. And usually these are given as like inhalers. Right? So inhalers are going to be like the mainstay of treatment for all COPD, whether it be bronchitis or emphysema or asthma. It's the quickest way to get like the medication straight directly into your lungs, right? Okay, so this is what chronic bronchitis looks like. These, again, this is the bronchi or the big tubes that split here. So this is what a normal one would look like, and see how like inflamed and how much mucus there is here. You can obviously imagine that it'd be much more difficult to breathe through these because they're so closed off. All right, now emphysema, this affects a different part of the lungs. Okay, so bronchitis affects the bronchi. Bronchitis, makes sense. Emphysema, these actually affect the alveoli, which are at the end of the bronchi, those little like grape-like clusters. Okay, so this one is a chronic obstructive disorder with chronic damage to those alveoli. Again, this is usually related to smoking. So smokers generally develop emphysema or bronchitis, but don't always assume, because I've seen people that have emphysema or bronchitis and they've never smoked a day in their life, but people tend to not believe them. They're like, oh, okay. But so it's important to realize that you can get these things and not have been a smoker, just like lung cancer. Obviously, most of the people who have lung cancer have been smokers, but it's possible to get lung cancer from other things like pollution, chemicals, people's job, exposure to harmful chemicals, and mold as well. All right, so symptoms of this: difficulty breathing, elevated respiratory rate, wheezing, coughing, using accessory muscles to breathe. What that means is you can, if you breathe normally, you're not really having to exert much effort. But when you use accessory muscles, it means you're engaging your abs and your rib cage, really struggling to push that air out. Does that make sense? You have to work. There's effort involved in trying to breathe versus normally you can just breathe and not have to exert yourself at all. Barrel chest, this is an interesting thing that happens. So let's show you a picture. This is a barrel chest. So this is what most normal torsos look like. Barrel chest, you can see, kind of looks like there's a barrel under the skin. It's this hyper. Yeah. So this is the best picture I could find. And
Wait a minute.
Yeah, I don't know. I guess he might have this, but when I googled barrel chest, this was the first image to come up, and it was the best one. I was like, all right, well, I guess this is what we're using. Yeah, you can see that what's happening here is that the lungs just remain in this state of like hyperinflation, right? They're like constantly blown up real big, so it looks like you're just overinflated. So that's a sign of emphysema. Is that Elon Musk?
Does it hurt?
I mean, it's not painful. It's just uncomfortable, makes it hard to breathe. That's why they have to use those accessory muscles to like force the air out, because it's just constantly overinflated like that. Pursed lip breathing is another thing that people do in conjunction with like using those accessory muscles to kind of like force the air out. So like when we breathe, normally we're just like, breathing through our nose or just breathing casual, but pursed lip, it's like they like go like this. And for some reason doing that makes it like there's more pressure to push the air out. So it's something they kind of do like subconsciously that helps to force that air out. Another interesting symptom is called clubbing of the fingers, and I don't know like why this occurs, but this is what clubbing looks like on the hands. This is obviously like a severe, you can kind of see how it looks different, right? Like it's like the nails kind of are like more bulbous almost and more round. It's like they have like a club, kind of like a round club at the end of their fingers. Can you kind of see what I'm talking about? So this, is kind of an indication that people have had the emphysema for a while. Like this doesn't happen overnight. This is just something that kind of like progresses eventually. So that's a big giveaway. Okay, so diagnosis, again, you're going to use pulmonary function tests. Pulmonary function tests are going to be, again, the diagnostic for all types of COPD. Again, that might also see it called spirometry. So this is going to look confusing, but you don't need to understand what this means. But basically, if you get a reading below 0.7, that's diagnostic of COPD, right? Because that's about 70% of oxygen flow. So the FEV and FEC just basically means forced expiratory volume. So like how much air you can forcefully exhale into that little tube. So you go, and they measure how much volume of that air there is, okay? And so a 70% or lower is considered COPD. Obviously, the higher the number, the better. So like, 70 is like a C. You can think of it like as a grade. Below C is failing, essentially. That's how I think of it. Treatment, again, the treatment for COPD is mostly going to be some form of inhaler, whether it be inhaled corticosteroids or a different class that causes bronchodilation. What is bronchodilation?
When the little bronchioles expand.
Expand. So like bronchoconstriction is it's like really tight and it's like you can barely get any air through, right? And bronchodilation, it opens up, and now there's a lot more air space. Okay, so obviously you want dilated airways to breathe better.
But they have, don't they have injections now for like that? Like Zolac, like injections.
Maybe. I'm not super familiar with that. I mean, most people are using inhalers. That's like a daily thing they can do at home. I don't know too much about that. But here's just an example of what a pulmonary function test might look like. They plug your nose that you can't breathe through your nose, and you breathe into this little, looks like a breathalyzer, kind of, and it just measures how much air is traveling in and out, and then you get a grade, okay? Should I do the clubbing? Should I do the barrel chest? And again, here's what's happening to the alveoli. So this is what normal alveoli look like. You have like these clear segmented clusters. In emphysema, they're like hyperinflated, and that's why your chest is hyperinflated, right? Because all of your alveoli are being kind of stretched out, full of air, right? So it's like your whole chest is looking like that. Any confusion over any of this so far? Okay. And again, the last one is asthma, and I've sent you guys homework about that in a video to watch because it's not in the book. All right, so now we have pleuritis. So this is inflammation of the pleura. The pleura is a membrane, like a thin little layer that surrounds the lungs. So like this, for example, this blue outline is just the membrane, and when it's swollen and inflamed, it's like this red, okay? So symptoms of this is just gonna be very painful when you're breathing in, because if something is inflamed and you're breathing in, it's like going to be putting pressure on that membrane that's already irritated, so it's going to hurt to breathe in. Also some fever and chills. And because it hurts to breathe in, people are going to have very shallow and rapid breaths because it's going to be painful to take deep breaths, right? So those kind of like shallow, uneven breaths, which can develop into pneumonia, right? Because if you're not exercising those lungs and getting full deep breaths, you can get pneumonia. Diagnosis of this, often they look at signs and symptoms. They can also listen. Auscultation is when they listen with their stethoscope to the lungs, right? Doctors and providers do a lot of diagnosis off of auscultation or like what the lungs sound like. There are different sounds that can indicate different diseases. And so a pleural rub is literally what they're hearing is when people take a deep breath in, they hear kind of like a rubbing sound, and that's like the membrane having friction against the lung tissue itself because it's so irritated and inflamed, they can actually hear like a rubbing sound. So that's a good indicator of pleuritis. If it is caused by bacteria, they can do obviously antibiotics. Pain meds also to help them breathe deeply because they need to be able to breathe normal to prevent pneumonia. This is an acute illness. Usually it gets resolved with treatment. All right, then we have a pneumothorax. All right, so a pneumothorax is basically a collapsed lung, okay? Let me show you a picture. So this is obviously a normal side. You can see this lung is kind of deflated. Think of the lungs kind of like a balloon, right? They get puffed in and out, right, when they have air. So if there's some kind of hole in the lung, it won't be able to hold air, right? If you're trying to blow up a balloon and it has someone pokes it with a pin, like it can't stay inflated because it's going to be constantly losing air. So that's what's happening here is the lung like is unable to inflate all the way because there's some kind of hole allowing the air to escape. And so the hole can occur either inside the lung itself or it can occur from something outside. So if someone were to stab you, right, through the ribs and into your lung, that would be a hole from the outside, right? From the inside could be maybe you have really bad lung cancer and there's a tumor and maybe it ruptured and it ate away on the lung tissue itself. So there's not like a hole from the outside of the body, but the lung itself like has a hole in it, right? So that's just how that can happen. A GSW, that's a gunshot wound. So if someone gets shot into the rib cage, it can puncture the lung. A broken rib sometimes. That's the danger of broken ribs, is if they angle inward towards the lung itself, it can pop the lung. So symptoms of this, obviously, shortness of breath. You feel like you can't breathe. Sharp chest pain, obviously, because there's a hole in your lung. Blood pressure might drop. Rapid and weak pulse. So this is, again, because you don't have enough oxygen, and so your body needs that to survive. Cyanosis, and what's that again? Turning what? Turning blue from lack of oxygen. And again, that anxious feeling. It's kind of like, that anxiety of like when you feel like you can't breathe, or like if you ever been held underwater, someone like joking around dunking you, and it's like you get that panicky feeling of like I can't breathe. That's very common. Diagnosis wise, they'll obviously just do some kind of imaging and they'll see the collapsed lung on the imaging. So whether it be CT, MRI, X-ray, whatever. So treatment, they're going to put you on supplemental oxygen. If there's an external, wound, like someone stabbed you or shot you, they'll cover up the hole and kind of try to patch it as you try to learn to breathe. And again, prognosis is just how quickly they can address the issue. If they can fix it quickly, people are just fine. I've seen plenty of people with pneumothoraxes that go on with no problems. If it's not addressed, especially if it's both lungs, right? If you have one lung that's still functioning, you have a lot more likelihood of survival. But if both lungs are punctured and you don't get treatment, then it's obviously probably going to be fatal. So again, here's that picture. These little white dots are just showing you like the air that's escaping from the lung. So it's like in the again, remember this is the pleura, the membrane surrounding the lung. So the air gets trapped between the membrane and the lung itself. Now there's another thing called a hemothorax, which is the same thing, except instead of it being a pneumothorax, pneumo being air, heme is blood. So instead of air being trapped in here, sometimes blood can get trapped in there. Like, for example, if you get a stab wound and it goes just deep enough to get into the pleura but doesn't actually puncture the lung, blood can start accumulating in there and then putting pressure on that lung, which forces the air out. So really the only difference you need to know is that a pneumothorax is air and hemothorax is blood. So to treat this, they would just puncture the pleura, drain that blood out, and then the lung will be able to inflate again. Does that make sense? You okay?
Yeah, that sounds horrible.
Yeah, I mean, none of these things are pleasant.
Yeah.
Most diseases are inherently unpleasant. All right, tuberculosis. Who's heard of tuberculosis? Anybody? Most people have heard of it, but it's not super common, fortunately. Tuberculosis is one of those things that most healthy people do not get. It's one of those opportunistic things that people with healthy immune systems generally don't have. So obviously people that are immunocompromised, like people with HIV, for example, are more likely to get tuberculosis than the average healthy individual. Okay. Risk factors, like I said, to get tuberculosis, HIV being a big one. People that are malnourished, just because when you're malnourished, you don't have enough, stored energy and immune system to be able to fight off infections. People that are in poor health, and then crowded, unsanitary conditions where there's just rampant sickness. So the big one for this, as far as symptoms, is night sweats. This is kind of like a unique symptom associated with tuberculosis, whereas a lot of the other ones are going to be like difficulty breathing, shortness of breath, wheezing. It's like, okay, well, every respiratory disease is going to have that, right? So it's like, okay, you're having some kind of respiratory issue. Night sweats are unique to tuberculosis. What else? Weight loss as well is kind of unique to tuberculosis. You generally don't have weight loss with a cold, So diagnostic for this, some of you may have had this. Some jobs require a TB test. Anybody ever had one? Yeah, where they inject a little bit of a fluid. You've had, yeah. They inject it really shallowly under your skin. So basically what's happening here is they're testing to see if you have antibodies against tuberculosis. Okay? Now, I'm thinking back to the immune chapter, which a couple weeks ago. When you get sick, a foreign invader comes into your body, whether it's a virus, bacteria, what have you, it takes a minute for your body to be able to fight it because you have to develop antibodies, right? Your body has to be like, okay, this foreign invader's come in, we have to create a specific antibody to fight this, right? Because it's very specific. Antibodies only fight one specific type, right? So if you have antibodies against tuberculosis, that means that you have been infected at some point, right? People that have never had tuberculosis have no antibodies against tuberculosis. Make sense with me so far? So the test, the MAN2 test or the PPD test, those are the two different names for the same thing. What they're doing is inserting a tiny, tiny bit of the tuberculosis bacteria, but it's dead. It can't actually infect you. And then seeing if your body has a reaction against it. If your body has a reaction against it, that means that you have antibodies already ready to go. Right? So this is what a reaction would look like, okay? So most people don't have this. This is called induration when you have all this redness. That happens when your body's trying to fight it because you already have antibodies, okay? So that just tells someone that you either are currently sick with tuberculosis or you've had tuberculosis at some point in the past, right? Most people have never had tuberculosis or ever been exposed to it, so there will be no reaction. It'll just look like normal skin. There should be nothing that you might see a little poke from where the needle went in, but that's it, right? So if a tuberculosis test like this comes back positive, that just means that you have either been sick with it before or you're currently sick. And now to determine whether or not you're currently sick or not, they have to do a follow-up chest x-ray, right? Because they don't know if you currently have it or not until they do a chest x-ray. If they do the chest x-ray and it comes back clean, that means that you're not currently sick with it and that you might have just had it in the past and you've recovered, okay? So a chest x-ray is the only way to determine whether or not you're currently sick if your tuberculosis test comes back positive. Does that make sense? So if you've ever had tuberculosis in the past, this test is going to be pretty much useless to you, right? Because it's always going to show up as positive, right? Even if you're not currently sick, because you always have those antibodies. So if you've ever had TB, you're going to always have to do a chest x-ray to confirm whether or not you're currently sick. Does that make sense? And that might be a little confusing. That's why I want to take some time to explain that. And then for treatment-wise, there is a specific antibiotic regime, which again will be towards the end with the rest of when we talk about the medications. that is specific to treat tuberculosis because it's a rather difficult illness to treat. So it's like very intensive antibiotics for extended period of time, and we'll talk about that later. Okay. Probably do one more and then we'll call it. All right, yeah, mononucleosis, you might just know it as mono. It's also pretty common. Some people call it the kissing disease, right, because it's easily passed through saliva, and it's most common in like the young adult, adolescent age group because they're often, swapping some saliva. That's why they call it the kissing disease. What's causing it is the Epstein-Barr virus. Very contagious, and the symptoms of mono are like people get extremely tired. Like the fatigue is like unreal. I've never had mono, but I know people that have had it, and it can last for a while, right? It's not like you have it for a week and you're done. It can last for a few months, like just this feeling of intense fatigue. Anybody ever had mono? You have?
Yes, and it was so bad. Me and my sister, we had it together because we all used to share drinks at my dad's house.
It's very easy within families to spread it because you're just in contact with everything.
And we went to the doctor like 4 times, and they kept on telling us, it's just a virus, it's just a virus. So, like,
I mean, it is technically,
test.
yeah.
And they were like, no, it's just like a stomach virus. That's what they kept on telling us. But we were like, will you just do a blood test? Because they wouldn't do it.
That's
and
weird.
they finally did, and then they were like, yeah, that came up quick. We were like, yeah.
How long did you have symptoms for?
We had symptoms for like almost 4 weeks.
Yeah, it can be a while. Did you have any swollen lymph nodes?
Oh yeah.
Yeah,
We
bad.
were both like, my mom said it was sad to look at us.
Wow.
Yeah. So anorexia, people see anorexia, they think of like the eating disorder. In the medical term, anorexia just means weight loss. So it doesn't have to be related to an eating disorder. So just don't get confused by that. That just means you're losing weight. And that's usually just due to you just feel so gross and your lymph nodes are swollen, you don't feel like eating. Chills, sore throat, headache, tonsil stones. So again, you might have the same kind of, did you have any of this? Like the tonsillar exudate? Yeah. So that's something that's similar with strep.
My sister had it worse than me though.
Yeah.
It was like her whole back.
The whole throat, yeah.
I had that, but I didn't have any throat problems.
It doesn't always, not everybody always has all the symptoms, so.
Okay, I thought I had strep throat.
So this can be difficult to distinguish between strep and mono, and that's why they do a test, because if it's strep, they can give you antibiotics, right, because it's streptococcus bacteria. If it comes back as Epstein-Barr, then they can't give you antibiotics, right, so they have to just treat the symptoms. And that's what the test that she was talking about, the blood test, the mono spot is often what they call it. Yeah, and this is an acute illness. It's just kind of a longer acute illness than most others. It can take a couple months to get over this.
When I had it, they freaked out because I've been going to the gym and they were like, you don't need to be doing anything right now.
Yeah.
It's something about your liver or something.
Yeah, your liver can.
She's like, if you get hit in the stomach, because she stared at me, I'm like, what are you talking about? I've been going to the gym and she would act like I was going to die.
Some providers can be more conservative than others. Some people with mono can have like an inflamed liver.
Yeah.
Not everybody, but they usually tell you to not do sports just to prevent any like.
She's like, and how long have you been going to the gym? I'm like, 2 weeks.
I mean,
like,
going on the treadmill probably isn't
Yeah,
going to
that's
hurt
all
you
I'm
because there's no
saying.
impact.
Yeah.
But like people that do like football,
Yeah.
and they're like tackling you, maybe don't do that.
Yeah, I was, and I think that's why I didn't do it as bad, just because I was trying to go to the gym to
Yeah.
work out.
It's just a better safe than sorry type of thing.
That's what she told me. She's like, I don't want you doing anything for 2 more weeks.
Yeah.
Whatever.
Yeah, so I didn't get into all that just because you guys don't need to know
No,
all the
I was
stuff.
just curious of why they kind of was talking about the liver, but
Yeah, it can cause the liver to grow and kind of be bigger than usual, and when it's swollen like that, it's more likely to have rupture.
Okay.
So they generally tell people not to do sports until they can assess you again. But we'll go ahead and stop there because we only have a few minutes left. I will post this at some point